Joy Parsons. Joy is the Chief Executive Officer of Fairhaven Society. And again, all of our speakers' bios are coming as they appear on screen. So Joy, the floor is yours. Please go ahead.
Joy, you're muted there. We'll just get you to unmute yourself.
You would think I'd be better at this tech stuff by now, right? 4 months or 5 months of Zooming and I still haven't got it figured out. But what I was saying to myself and no one else is how exciting this discussion is, because I'm in agreement with so many pieces that are coming forward, and I'm so appreciative that everyone's here sharing their expertise. As Habib mentioned, I'm the CEO of Fairhaven Home Society. We are a charitable nonprofit organization. We provide homes and care to more than 600 seniors in Burnaby and Vancouver. All of our staff are unionized staff, and we have fabulous retention statistics with our staff. I'm also the chair of the Vancouver Coastal Administrators Council, so a number of my colleagues and I get together on a regular basis and talk about our challenges. But today I just want to speak about my own experience. So I'm not wearing the hat of the Vancouver Coastal Administrators Group or the Fraser Health Group. I just want to speak about my own experiences through COVID. We have 2 long-term care facilities and 3 independent living facilities, all totaled, as I mentioned, 600 seniors that are supported through Fairhaven. We have more than 400 staff that are also supported through Fairhaven and the services that we provide. When I look back, Jen said, what were we talking about in January and February and what happened in March? I have no recollection of March or April. It was chaos. It's all a blur to me. When I think about the challenges that we faced, it's really hard because there was so much going on. And so when I think about those challenges, I just want to say chaos. So there was chaos because there was anxiety. There was anxiety with my staff. There was anxiety with the families. We had so many uncertainties going on, so many questions. One of the biggest challenges that we faced was trying to weed through all of the information coming at us. So many of our partners in the system and care were trying to be helpful and provide us the latest information, but it got overwhelming. Daily, I would receive more than 30, 35 emails on the latest equipment to use or the greatest suggested infection control practices. So part of my challenge was really trying to navigate all of the information coming out. And again, I applaud everyone's intention to be helpful, but it was very, very difficult for us. And what I was trying to gather was, what information can I take to my team to answer questions and to reduce the anxiety? Because my team, we took the approach of, we are going to tackle this head on. We're not going to be afraid. We're not going to hide. We're going to embrace ourselves. We're going to be educated. We're going to provide as much information as we can to our staff, to our families, to our residents, to all of our partners. And it was just really hard to filter through on what is the information. And understandably, unprecedented. And I was tired of that phrase, but the reality is everything we were going through was unprecedented. So the information did change daily, and new learnings happened daily, and new understandings happened daily. But for us, we really value our staff. Right at the beginning, our board was dedicated to making sure that our staff had what they needed to feel comfortable in their job, have the tools that they needed to do the work that they were doing. We're not fearful of losing their positions or challenges. But admittedly, early on, and I'll sidebar by saying, thankfully, we have not experienced an outbreak at any of my 5 buildings. Thank you. But our staff were afraid. And, we talked about staffing shortages that were present prior to COVID. We lost some staff just out of fear right in the beginning. Like, people just went into hiding and didn't want to work. And as I say, our board really supported that we support these staff members to, feel safe and do what we can to ensure that they're not worried they're losing their work, or that, they still have a home in the Fairhaven family. And when we can get them back into a place where they're comfortable working, we'll do that. But that was a lot of the work that we had to do early on. You know, our leadership team, God bless them, they're fabulous. I'm sure they all will say they don't remember March and April either. Everybody worked 18, 19, 20-hour days, just trying to be there for everybody. Our staff, as Lou mentioned, those staff that remained with us, we were short-staffed already. It got shorter. How did that time happen so fast? Short staff already, and then COVID happened, and our staff are working more than is humanly acceptable, but they're there because they are dedicated to our residents. It's our staff who were so so dedicated to making sure that we're keeping our residents safe and keeping our staff safe. Our challenges with PPE, they were coming up with solutions. You know, we had everybody on the internet. How can we make PPE? How can we get PPE? How can we reuse PPE safely and effectively? And I really applaud all of our staff for doing that. So, you know, my hopes going forward, our healthcare heroes, they're labeled as essential workers, but I don't think historically we've treated them that way. These staff are critical. And, you know, we talk about making sure people have good wages. All of my employees are union employees following the Master Collective Agreement. They have good wages, they have good benefits, but living in this community of Greater Vancouver and the Lower Mainland, it is not a living wage for them. So they are working multiple jobs because of our environment. So, you know, and the majority of our staff are full-time positions. So somebody asked about that. Almost all of our staff are full-time positions, but I still have challenges on an ongoing basis. So, you know, I could talk forever. For me, it's been a crazy learning experience. Our staff are the foundation of making sure that we're doing the best that we can. They are dedicated to our seniors. They are dedicated to the families. It's our staff who created solutions on how to get families back in and visit them. It's our staff who are really helping families, teach them the infection control because they know how important the families are. Kudos, Jen, thank you so much for the family education online. We almost require our families to participate in that education before they come back, but it really is helpful. We're trying to stay connected, communicate, keep everybody informed, all of those things. So yeah, we've learned a lot through this pandemic, and we continue to learn on a daily basis. Life continues to change and we're learning new things. I just hope that lots of good things come out of this in the future.
Thank you, Joy. Lots of interesting insights and experiences from Fairhaven. Looking at some of the questions and comments here, let me share with you one comment here and get your response. Why do staff have to work 14 to 20-hour days? The staffing has been so curtailed by provincial financing that there isn't any cushion for difficult times. So what do you have any thoughts?
That's a really interesting question and a conundrum that we have. So we currently, the funding model is almost directly related to tasks that happen in a day and hours of resident care that are provided. And for us to be funded appropriately, we have to maintain a certain number of hours of resident day or hours of resident care that we provide every day. If we don't achieve that, the funding gets clawed back. So we lose that funding if we haven't hit those hours per resident day. My organization, and I won't speak for myself, we try very hard to not allow people to work a 14 to 20-hour day. So we've worked collaboratively with our staff to come up with creative solutions to how and to fairly and equitably move overtime shifts so that people aren't doing that. It's not good for staff. It's not good for the staff's families. It creates exhaustion and fatigue, and that leads to questions in quality of care and mistakes. Sadly, though, we do have to meet requirements of care for us to maintain our funding, and our margins of funding are very limited. So to the thought of care dollars being clawed back because we haven't achieved those hours is difficult. But, yeah. I don't know if that answered it, but for me, that's a challenge. We try really hard not to have any staff work double shifts ever.
Mm-hmm. Thank you. There are a few questions about staff mental health support. So about bringing in counselors and giving more effort and support in on that front, which is a critical front that has been mentioned by other speakers as well. So your
Yeah.
thoughts on that, Joy?
So I agree. As I mentioned, some of the biggest challenges we had in the beginning were the staff anxieties. Fairhaven, we have an employee family assistance program that we provide, and we make sure on a regular basis staff are aware how to access that individually. We also use our daily safety huddles to talk about different topics, and one of those topics is self-care and how to manage self-care, and how to access services if you're needing help. I'd like to believe that our organization has very open door policy and people feel comfortable walking into my office and asking for help or raising a challenge or highlighting a need. And I know very deliberately that my direct care managers are engaged daily in conversations with staff on how we take care of ourselves. We do have done a numerous amounts of staff appreciation sessions over COVID. Just last week, we brought in boxed lunches for everybody. Thank you to BC Care Providers and Safe Care BC. They've accessed a lot of donated materials. We had beautiful chocolates that we had for staff on a regular basis. We had a number of like hand sanitizers for staff to use and take home. We purchased materials for staff to take home for their families so that they can feel safe there. But it's that family approach to making sure staff know that they are cared for and they are supported. Because the anxiety is high. And I can say for me, our staff, the average age of my staff is over 47 years old. So these staff are sandwich generation. They're caring for their own elders. They may have kids at home. There's lots of challenges, and we just do whatever we can to support them.
One last question for you before we move on. I think you mentioned about education for families. And there's one question about if you can elaborate on the education referred to for families.
Oh, so I should put that back to Jen, but Safe Care BC worked in partnership with, I'm going to get the name wrong, it's gone for me, a family support group that works for families who are providing support for families giving care, and have created online education sessions on how to enact infection control and safety procedures. It's accessible to everyone online, and I think actually Jen should answer that because she knows more about it than I do.
Yeah, thanks, Joy. So it's in partnership with Family Caregivers of BC, and basically, it just came out of the fact that when we were understanding what the issues were, there's a real fear, and arguably it's a valid one, of family members inadvertently introducing COVID into a care home. And we know that this is coming at a time when sites are incredibly strapped for staffing resources. I mean, Lou spoke quite eloquently to the challenges that people face around facilitating safe family interactions. So this was kind of our way of making things just a little bit easier. It doesn't replace the site-specific orientation that needs to happen, but it helps ensure that people walking in the door already have a baseline understanding what they need to do, so that you're not having to explain to somebody, yes, you need to wear a mask. Yes, you need to wash your hands for 20 seconds. Yes, you should keep your bubble small if you're supporting someone in long-term care. So that's what this was intended on doing. And it's free. So it is free, it's publicly available. And that's how we wanted to help support that safe reintegration of family members back into care homes, because we know this is something we're going to be dealing with for months. And the emergency measures we put in place into March aren't sustainable in the long term.
Okay. Thank you, Jen, for that answer. And thank you, Joy, for the presentation and taking those questions.